RSV infection causes significant morbidity and mortality in older adults and in immune-compromised patients, in particular in patients with hematological malignancies. Recent approved RSV vaccines show high efficacy in older adults, but there's limited data in patients with hematological malignancies. Therefore, we performed a prospective trial that evaluated the safety and efficacy of RSV vaccination, which is a recombinant RSV perfusion F protein vaccine in 102 patients with CLL, multiple myeloma, and a non-Hodgkin lymphoma. We measured anti-RSV IgG levels at the day of vaccination and 4 to 6 weeks afterwards, and we correlated the response with demographics and clinical parameters. We also followed after adverse events related to the vaccine. 79 patients were evaluable for a response. The overall response rate was about 28%, which was numerically higher in patients with multiple myeloma compared to CLL and non-Hodgkin lymphoma. And the only statistically significant parameter that correlated with response was exposure to anti-CD20 therapy. Patients that were treated with anti-CD20 antibodies achieved response rates of only 8% compared to 42% in patients that were not treated with these antibodies. Patients that were treated with anti-CD20 antibodies within 12 months of vaccination, none of them responded. And the response rate in patients that were treated with BTK inhibitors monotherapy was about 43%. Regarding safety, most of the adverse events were grade 1 and local, only a few grade 2, and no grade 3 and higher adverse events. In conclusion, RSV vaccination in patients with hematological malignancy is very well tolerated. However, it showed a diminished serologic response, in particular in patients that were treated with anti-CD20 antibodies.